So, good day, ma'am. Good morning, and also classmates. Good morning. Now, I'm going to discuss about drug administration, which is the 12 rights of giving medication and its examples, different routes in giving meds, examples of different meds, and each routes. So, drug administration can help prevent many medication errors. Nurses who are primarily involved in the administration of medications benefit from this simplified memory aid to help guide them to administer medications safely. Nurses are responsible for ensuring safe and quality patient care at all times, as many nursing tasks involve a degree of risk. Medication administration arguably carries the greatest risk. So according on the research and medical administration errors show that there is a 60 error rate, mainly in a form of wrong time, wrong rate, or wrong of dose. Some medication errors cause permanent disability, and for others the errors are fatal. A set of guidelines that medical professionals adhere to when administering medication to ensure the highest level of safety for patients. So, kaning drug administration, no, kanang pamaraanin nato as a healthcare worker, dili lang sa nurse, all the healthcare workers nga makabalo ta sa sakto nga pagkuan sa drug administration kung unsaon nato paghatag sa sa atong mga patient sa sakto nga pamaagi para paghatag sa ilang medication. So, there are 12 rights on giving medication. First, right patient. Second, right drug. Third, right dose. Fourth, right route. Right time and right frequency. Right assessment. Right approach. Right of client to refuse. Right of client to know the reason of drug, or right of education and information, right drug evaluation and interaction, right documentation, and lastly, right drug preparation or the expiry date. So, kani siya nga mga right kailangan gini sa ato as a healthcare student or healthcare worker or sa atong mga kuan nga makabalo ta ani kung unsaon nato paghatag sa medication sa ka patient. So, ato na explain later isa-isa. So, sa 12 rights, there are the common or the basic rights on giving meds and its examples, or there is many explanations. So first, right patient. Ask the name of the client and check his or her ID band before giving the medication. Even if you know the patient name, you still need to ask just to verify. So, syempre, kung maghatag taog medication sa usa ka patient, so right patient yun, ato siyang pangutanon sa iyang name, bisan og nakabalo na ta sa iyang name, pangutanon gid nato siya, i-sure gid nato siya kung mao ba gid na siya nga patient ang atong hatagan og medication. Kay basin og pareha og name, nabayay parehag name, parehag apelyido, pero lahi nga patient, dili siya mao. So dapat gid nato i-verify og taro. So, second, right drug. The first right of drug administration is to check and verify if it is the right name and form. Be aware of look-alike and sound-alike medication names. Misreading medication names that look similar is a common mistake. This look-alike medication name may also sound alike and can lead to errors associated with verbal prescription. Kung sa right patient, hagid po siya right drug. Kay kung kinsa imong hatagan og tambal sa usa ka patient, imo po na siyang kina-check kay basin nabay the same sound na tambal or drug. So dapat nato gid i-check kay basig ma-misreading pud ta paghatag sa tambal sa patient. So dapat gid nato ang right drug. Right dose. Check the medication sheet and the doctor's order before medicating. Be aware of the difference between an adult and a pediatric dose. So, sa paghatag sa dose, so lahi man nun na may mga adult nga dose, pangbata nga dose. So, ato po na siyang i-check ay hatag og medication. So, dili gid ta magkuan nga pare-pareha ra tingali ni. So, dapat dili gid ingon ana i-check nato kung unsay sa medication sheet and also the doctor's order kung unsay giingon didto kung pila ka dose ang ihatag sa adult na patient, kung pila gihatag sa pediatric patient sa dose. So ato ginahikuan ang iyang right dose. And also, right route. Check the order if it is oral, IV, sub-Q, IM, or etc. So, kaning right route, ato po siyang i-explain later kay there are so many different route for giving med. So, right route, kung pag ingon sa doctor's order dito nga, give medication to this patient with the route and oral medication. So, ato nang i-explain ang unsay oral. So, ato pong ikuan kung unsa nang right route. So, dapat gyud mosunod kita atong i-clarify, i-verify, i-check, or kapila nimo i-check before and after kung sakto ba gito imong gikuan. So, dapat gyud ingonana. Then, next, right time and frequency. Check the order for when it would be given and when it was the last time it was given. So, dapat pod sa right time and frequency, dapat pod gina-check nimo kay lahi man na ang kuan sa patient, no, dili ra man ikaw ang hatag og medication. So imo ginasulat sa imong order, imo po nang gi-check kay kanus siya gihatagan last time or bago pa gihatagan kay basig magdubol-dubol na sa imong nang gina-check after and before. So dapat ang iyang right time and frequency dili gid kuan dapat gid masunod. So next one is write documentation. Make sure to write the time and any remarks on the chart correctly. So, kani po siya pinaka-importante po din siya, no? Kani sila tanang pinaka-importante, pero dapat yun kita, kung kita na yung kuan sa patient, so ato po write documentation, clear documentation yun kay. Ato ibutang dito kung kanus ani mo siya nahatagan og tambal, kanus ani mo siya gihatagan og next na last time ana. So write documentation to the chart sa para gid sa pagka next nga mo kuan nga healthcare or nurses or any healthcare provider, so makabalo na siya kani last ni siya nga kani nga time last year gihatagan og tambal. So kana gyud ang kuan pud sa right documentation. Next one is write history and assessment. Secure a copy of the client history to drug interactions and allergies. So, no, natakol naman ni nato sa mga last na to nga topic kaning about sa history and assessment. So, before tahatagan nato ang patient og any medication, so makabalo na gito sa ilang mga history. So, ato ginang plaster kung asa gid ang ilang mga history, ilang mga kuan kay basin unsay mga ilang mga allergies. So ato rang tan-aw didto kung ay kanina siya allergy diri so dapat makabalo ta kay basig tagaan og tambal nga makasamot pa hinon siyang allergies. So mga difficult na hinon ang iyang pagkuan sa patient. So dapat naka write history and assessment gyud naka-secure gyud ang copy sa client history para makabalo pud ta kung unsay ilang mga allergies. Drug approach and right to refuse. Give the client enough autonomy to refuse the medication after thoroughly explaining the effects. So imo nag-explain sa patient nga, ma'am, mao ni nga tambal akong ihatag sa imo. So nani siya mga side effects, ma'am. So ikaw as a healthcare provider or nurses or any kuan sa medical courses or kuan, so dapat kita pod makabalo pod ta nga okay kanang nasilay karapatan nga mo refuse sa medication kung basin dili nila kaya na nga kuan mga side effects. So imong ikuan ang patient nga, okay ma'am. So drug approach and right to refuse. Right drug interaction and evaluation. Review any medication previously given or the diet of the patient that can yield a bad interaction to the drug to be given. Check also the expiry date of the medication being given. So no, sa paghatag mo na sa patient interaction and evaluation, so every na to maghatag ta og medication gina-check na to kung kanina ba expired na ba ni siya, kanang na ba siya yung mga notes more. So dapat gina-check mo na nato siya ay na to ihatag sa patient to medication. So also right education and information. So provide enough knowledge to the patient of what drug he or she would be taking and what are the expected therapeutic side effects. So, sa kaning right education and information, so kaning imo siyang i-educate o makabalo siya sa information unsa na siya nga medication imong ihatag sa iya kay basin pa lang dok ma'am unsa may gihatag sa ako, so dapat gyud ayha nimo siya na hatagan sa iyang medication, nakabalo siya unsay mga side effects, unsay mababatian niya ani sa pag kung i-take niya. So dapat gyud kita as a healthcare provider soon inana provide dito sa ila kung unsay enough knowledge ihatag nato sa ila unsay mga tabang sa ila or mga side effects. So, right education and information. So, those are in the 12 rights, there are the 10 basic or important. So, kaning mga importance ra gid kay ni siya. And then, this one is the different routes in giving meds and also the examples of different meds in each routes. So, channels of drug administration. So, na-share channels, no? Enteral, parenteral, and also the topical. The classification, there are two classifications, systemic and local. In the systemic, there are two types, the enteral and parenteral. The enteral are three kinds, the oral, sublingual, and rectal. So, ito explain na siya isa-isa niya mga every routes in giving meds. And also parenteral, there are inhalation, injection, and transdermal. Injection, there are 7. Okay, 7. Sa intravenous, the IV, intramuscular, IM, subcutaneous, subQ, intraarterial, intraarticular, intrathecal, intradermal. So, kani siya, nakabalo na taan ninyo kay sa itong mga last topics about sa mga injections. And also the local, skin topical, intranasal, ocular drops, mucosal throat, vagina, mouth, ear, inhalational, transdermal. So, ito na isa-isa no explain niya. So, sa katong makita nato sa itong picture, kani siya no, mo ni siya ang mga routes kung asa mga probably maghatag og medication kung asay probable gid ihatag ang medication. So, enteral, oral, sublingual, or buccal, rectal, not soluble, enteric-coated or slow-release formulation. Parenteral, IV, IM, SC, or subcutaneous, ID, intradermal, IT, etc. Different rates of absorption, different plasma, text nuts, IV, and fusars. Skin for local or systemic effect. Lungs, inhalation, local or systemic effect. Vaginal, usually local. So, kani siya mga routes nga probably ihatag ang mga medication. So, factors governing choice of route. So, factors, mga kadahilanan. So, factors governing choice of route, physical and chemical properties of drug, solid liquid gas solubility, stability, pH, irritancy, site of desired action, localized and approachable, of generalized and non-approachable, rate and extent of absorption from various routes, effect of digestive juices, and first pass effect, rapidity of the desired response, emergency routine, accuracy of dosage, condition of the patient unconscious or vomiting. So kani siya ang mga factors to governing choice of the route, kung asa ang choice of route ng mga kadahilanan or factors. Maghatag og medication kung asa hatag pamaagi kung asa iagi ang medication or the routes. So, enteral. The enteral, the first is oral route, the most common route of drug administration. Drug is given through oral cavity. So, kaning oral route sa atong enteral is oral route. Kanang, sa atong baba, pinaagi ang pag-inom og medication, pagtambal. Kani siya ang pinaka-common yun kay bisan kita self, pwede na tamo inom ani. Kintay na tinabatian og labat sa ulo. So, inom taog na tambal. So, common na siya kayo nga route sa oral. So, na siya advantage. So, safe, convenient, self-administered, pain-free, non-invasive, and easy to take. Economical compared to other parenteral routes. Usually, good absorption take place along the whole length of the GI tract, no need for sterilization. So, kung yun kayo siya, common yun kayo siya kay safe, and then, pwede yun siya self-administered, wala siya sakit, may mong mabatian kung kuan kag medication, and also economical compared to other parenteral routes. So, parenteral routes, I i-explain later. And also, dili na po siya kailangan og sterilization. So, kung na siya, common na siya, safe. Kung na siya advantages, na po siya disadvantages. First, slow absorption, a slow action cannot use in emergency. Irritable and unpalatable drugs, nausea and vomiting. Cannot be used and cooperative vomiting and unconscious patients. Some drugs destroyed. Sometimes inefficient drug absorbed. Some drugs are not absorbed like streptomycin. First pass effect due to biotransformation and also food-drug interaction and drug interaction. So, kung na siya advantages nga safe siya, most common route, so na po siya disadvantages, no? Slow ra daw iyang absorption, then dili gid po siya pwede ka ng mga patient nga unconscious. Syempre, imo lahi man gid ang kuana na. So, may other route ana para sa mga patient ngayon na. So, mo na siya mga iyang disadvantages sa oral route. So, mo siya mga examples nga mga medicines para sa oral route. So, examples is capsules, powders, tablets, spansol, syrups, emulsions, suspensions, and elixirs. So, mo siya no ang mga oral route nga medicine, mga capsule, naman ito yung tablets, hard gelatin capsule or soft gelatin capsule. Next is sublingual route, is where the dosage form is placed under the tongue, rapidly absorbed by sublingual mucosa. Tub or pellet containing the drug is placed under the tongue or crushed in mouth and spread over the buccal mucosa. Example is GTN, buprenorphine, disaminic oxytocin. So, mo na siya, no? Pag-inom nga ipailawom sa dila, sa tongue, placed under the tongue. So, na siya advantages, economical, quick termination, first pass avoided, drug absorption is quick, can be self-administered. So, murag connected gyapon siya sa oral route, pero kani siya kay murag specific gid ba sa sublingual route kung asa gid ibutang ang tambal. Kung na siya advantages, no, na po siya disadvantages. And unpalatable and bitter drugs, irritation of oral mucosa, large quantities not given, few drugs are absorbed. So, irritation could gyapon siya no kay ilaw man sa dila. So, nagyapon siya mga disadvantages. So, same raman ata kibali ang same ra ang mga medicine ano yung paghatag sa sublingual route. So, buccal route, where the dosage form is placed between gums and inner lining of the cheek or the buccal pouch, absorbed by buccal mucosa. Tabor pellet containing the drug is placed. So, mo gyapon ni siya no, murag same ra gyapon ni siya sa sublingual and oral. So, naram siya sa oral sa ba. So, advantages: avoid first pass effect, rapid absorption, drug stability, drug absorption is quick termination, first pass avoided, can be self-administered, and economical. So, disadvantages: inconvenience. Advantages: loss is if swallowed, small dose limit, unpalatable and bitter drugs. Irritation of oral mucosa, large quantities of not given, few drugs are absorbed. So, same magapon siya sa pagkuhan sa kanilang siya kay nasa inner lining of the cheek and the gums na siya pag-inom. And then, the rectal route, drugs that are administered rectally as a suppository. In this form, a drug is mixed with a waxy substance that dissolves or liquefies after it is inserted into the rectum. Example is diazepam, indomethacin, paralidaid, and ergotamine. So, muna siya mga tambal or mga medicine nga pinaagi hatag sa rectal route. So, kani siya nga mga kuan, mga tambal murag something nga kanang light kanang dili ka kalibang bitaw. Murag na siya isok-sok dito or ibutang sa lubot para nga makalibang ka katong giingon ni Ma'am Lisa man ata to. Basta katry po na kung mamaanak atong nalisod siya o libang. So, namo na siya ang rectal route. Mga medicine nga dapat ipaagi sa rectal route. So, advantages: use in children, little or no first pass effect. Example, hemorrhoid vein. May siya mga kuan. Use in vomiting and unconscious. Higher concentration rapidly achieved. So, kanina siyang rectal route, kasagaran daw ani is used in children and also kanang mga unconscious patient. Okay, so, and then also disadvantages: inconvenient, absorption is slow and erratic, irritation and inflammation of rectal mucosa can occur. So, irritation gid gyapon siya kay pinagid sa lubot or sa rectal route. So man nato sa enteral, there next is the parenteral routes. Ang parenteral route, so nagkuha na siya sa direct delivery of drug into systemic circulation without intestinal mucosa. So, dili na siya mo kuan sa sulod, pwede na siya pagpagi sa itong mga skin, tissue, muscle. So, ato na isa-isa sa like intradermal, subcutaneous, intramuscular, intravenous, intraarterial, intrathecal, intraperitoneal, and intraarticular. So, mo ni siya ang mga routes nga dili na siya kailangan nimo og kanang mucosa, no need na intestinal mucosa, kundi pwede na siya sa skin or tissue. So, kanin siya mga routes. Intradermal, inject into skin. Subcutaneous, absorption of drugs from the subcutaneous tissue. IM, drug injected into skeletal muscle. Intravascular, placing a drug directly into the blood stream. So, kani siya mga parenteral route. So, first pass metabolism of drug in the gut wall of or portal circulation before reaching systemic circulation to the amount reaching systemic circulation is less than the amount absorbed, where liver, gut wall, gut lumen result, low bioavailability Lability, short duration of action. So, short siya, dali lagi siya kay duration of action. So, ito rin siya explain. So, muna siya ang mga murag kung asa siya makuan. Drug administered IV. Kuhanin mo siya sa intravenous directly into the systemic circulation and have direct access to the rest of the body. So, kung IV atong ikuanom, ano yung makita na to siya. So, kung sa oral pa, layo-layo ra, makita sa picture, then, o kung oral, layo pa siya mabot sa kung kuan sa liver, kung sa body. Kung kuan ang gamiton, IV, so, dali lagi siya, dali ra, have direct access to the rest of the body. Then, kung oral, drugs administered orally are first exposed to the liver and may be extensively metabolized before reaching the rest of the body. So, kuan siya no, kay kung oral di mo, kuan pa siya og administered pa siya sa liver. Kung IV, kay diretso naman na sa rest of the body ka na. Diretso na din mo kanat ba? Balik na na. So, GI tract, general circulation, naman siya. Dali lagi kay siya kung ano yun. Oral food, mag-same with it din. First pass metabolism can occur with orally administered drugs. Okay. So, kung i-compare din nato ang oral o ang parenteral or the IV, kung specific, ang kuande, ang first pass metabolism can occur with orally administered drugs. Ang orally GDI. So, indication of enteral routes medications. Oral medication are convenient and are indicated for patients who can ingest and tolerate an oral form of medication. Some medication with short half-lives are administered orally as time release or sustained release form that get absorbed over several hours. Kanina siya, ang indication din siya atong enteral routes ganiha. Indication means kanang iyang palatandaan bitaw kung kani siya mga routes mo ni siya. So, ang oral routes niya, ang oral medication is convenient and indicated. Sublingual and buccal routes are indicated for medication with high first pass metabolism that need to avoid clearance by the liver. For instance, nitroglycerin is cleared more than 90% during a single pass through the liver. Therefore, it is given a sublingual form. The sublingual and buccal routes also have advantages of rapid absorption, convenience, and the infection incidence. So, muna siya mga indication sa itong enteral routes, no? So, before sa tamo proceed sa parenteral, ako sa explain ang indication of enteral routes. So, mag-wait yung slides sa anis. Okay. And also, the rectal route is useful for patient with gastrointestinal motility problems such as dysphagia or ileus that can interfere with delivering the drug in the intestinal tract. The rectal route is also often utilized in patients near the end of life undergoing hospice care. So, kanina yung rectal, ang yung indication ani, kanina ng ang mga makuha na din nato niyang route sa rectal route if ang patient na siya gastrointestinal motility problem. So, magiging siya. So, kailangan yun nato mabala ng indication sa atong enteral o parenteral or others route. So, parenteral administration. Advantages. High availability, rapid action, emergency, no first pass metabolism, suitable for vomiting and unconsciousness, irritant and bad taste drugs, no gastric irritation, no food drug interaction. So, ang iyang dosage form is vial and ampule. So, kaning parenteral administration gid sa iyang advantages gid ani, kato gid siyang high viability kanang rapid action, dali gid siya kay kung na suitable for unconscious maski nag-emergency. So, kailangan dili hatag dayon ang through IV or other parenteral routes or administration. So, ang mga tambal ani or medicine ipang dosage form is like vial and ampule. So, nakailan naman tag vial or ampule no sa ato na nang naila. So kung asa nato na dili man na pwede ipainom ng vial of ampule no disudpot. So kanang advantage po ni siyang mga parenteral administration or other parenteral routes kana po ng kanang dili bitaw ganahan mag-inom og tambal kanang paitan na sila, so advantage ni sa ila. And also disadvantages: infection, sterilization, invasive assistance require, pain, needs skill, anaphylaxis, and expensive. So ano po siya disadvantages. So infection, takbalo maka dili makuan sa tong lawas ang mga kuan nga medicine or medication about na, and need po siya og sterilization. And then pain po siya, sakit. And also kung ang maghatag ra gid na dili na siya self kuan administered ha, dili na siya pwede ang mga parenteral routes or administration. So kailangan gid na siya og mga need skill kanang naigi mga skill nga mabuhat ana nga paghatag og medication. And also mahal gid pud siya. Okay, so next, so mo no ampule in IV infusion katong pangtakal na ni Ma'am Dulo itong about sa paghatag sa mga oxytocin sa then vial itong pag-inject for IV. Okay, so begin first with the intravenous route. Advantages: IV is the most common parenteral route for drugs that are not absorbed orally. Avoid first-pass metabolism by the liver. Intravenous delivery permits a rapid effect and a maximal degree of control over the circulating level of drugs. Titration of those with response, large quantities can be given fairly pain-free. 100% viability absorption pace is by pass. So, kung sa enteral administration, ang ilang most common is oral, ang sa parenteral, ang kuan pod, ang most common pod is kaning intravenous kay mas dali ra man gud siya din, dili po ka maka-feel og sakit kay through IV man siya. Pero paghatag sa medicine pero pag taod sa IV, murag maka-feel po og sakit. And then kuan pod siya is drug absorbed. Drug that are not absorbed orally, dili gid siya kuan through IV intravenous sa vein. And the word venous, veins. So, disadvantages: however, unlike drugs in the GI tract, those that are injected cannot be recalled by the strategies such as emesis or by binding to activated charcoal. IV injection may also induce hemolysis or cause other adverse reaction by the too rapid delivery of high concentration of drug to the plasma and tissues, also vital organs like heart, brain, etc. So, thrombolytitis of vein and necrosis of adjoining tissue, extravasation occurs. So, muna siya mga disadvantages, no? Kanang, kung gyapon siya, kanang, unlike drugs in GI tract, dili siya kanang, those that are not injected cannot be recalled. So, intramuscular route. Large skeletal muscle, yung mga common nga parts nga makuan sa intramuscular route is deltoid, triceps, gluteus, maximus, rectus, and femoris. So, kanin siya, ito na na try sa itong pag-inject or pag-try sa kuan. So, intramuscular, like example, itong paghatag sa itong vaccine, sa vaccine for COVID. So, deltoid, direct part sa mga intramuscular, mga muscle. So, dito na siya, mga route nga ihatag ang medication. Advantages: absorption, reasonably uniform, rapid onset of action, mild irritants can be given, first pass avoided, gastric factors can be avoided. And disadvantages: only up to 10 ml drug given, local pain and abscess, expensive infection, nerve damage, local hematoma can occur in anticoagulation anticoagulant treated patient. So, kung kanida siya, ang disadvantages niya, ang intramuscular di ay kung ihatag ang mga dosage sa paghatag sa medication is up to 10 ml di siya kay, di ba? Sakit-sakit pa ba kung daghanon yun, no? So, paano siya? And subcutaneous routes at mga fats, sub-Q, mga fats na to. Drug is deposited in the subcutaneous tissue, rich nerve supply, irritant drug cannot be injected. Less vascular, slow absorption. That IM route avoid in shock patient. Vasocontraction, only small volume can be injected. Subcutaneous injection minimizes the risk associated with intravascular injection. Preparation can be injected. Mga pellet implantation, shallistic and biodegradable implants. So, kani siya no ang katong kung asa ibutang ang mga medication, ang mga fats. And also, intradermal route, inject into the skin, raising blood, BCG vaccine, sensitivity test. So, kani siya, kato ni siyang intradermal sa atong skin. Kato bitong try po ito natin pagkuhan sa atong skin. Injection. Ito mga ilan kung asang unsay allergies. Intrathecal or intraventricular, it is sometimes necessary to introduce drugs directly into the cerebrospinal fluid. For example, amphotericin B is used in treating septococcal meningitis. So, kani siya mga tambal niya. Ihatag pamagi sa intrathecal and intraventricular routes. So, there are so different routes na kung asa pwede ihatag ang isa ka medicine or medication. So, dapat yun kabalo kita kung unsay dapat kung asa ihatag ang medication nga route. Transdermal route, no? For example, ganin sa picture, like that. Makita ito mga patient nga na sila magkuan o tambal sa ilang intradermal route. This route of administration achieves systemic effects by application of drugs to the skin, usually via a transdermal medicated adhesive patch. So, na siya mga patcha-patcha. The rate of absorption can vary markedly depending on the physical characteristics of the drug, lipid soluble, and skin at the site of application. Slow effect, prolonged drug action. So, hinaragid siya of action or effect ang tambal kung transdermal route. This route is most often used for the sustained delivery of drugs such as the anti-anginal drugs, nitroglycerin, the antiemetic, scopolamine. So, the nicotine patches site, upper arm, chest, then abdomen, kayo naman tayo fats, I mean mga skin, and ang iyang common din nga site, then mastoid region. First pass effect avoided, absorption increased by oily base. Oily base kay syempre sa skin, transdermal, derma. Occlusive dressing, rubbing preparation. So, magni siya ng transdermal sa makita sa picture. And then, muna siya ang transdermal therapeutic system. Drug in solution are bound to a polymerase held in reservoir between occlusive backing film and rate controlling micropore membrane, under surface of which is smeared with an adhesive impregnated with priming dosage of drug. So, more convenient patient compliance is better. So, kung gini siya sa ila, no? Kung isa ka patient, mas convenient sila nga mukuan sila sa transdermal route. So, muna siya illustration niya, or figure, transdermal drug delivery system. So, makita nato sa backing fence drug reservoir, padong siya sa mga capillary, in rate controlling micropore membrane. So, mo na siya ang kuan. So, from the skin. Okay. So, kung naay indication ng oral routes, so na po siya indication ng parenteral routes in medication. Parenteral routes medication. An intravenous route directly administers the medication to the systemic circulation. It is indicated when a rapid drug effect is desired, a precise serum drug levels is needed, or when drugs are unstable or poorly absorbed in the gastrointestinal tract. It is also the route utilized in patients with altered mental status or severe nausea or vomiting, unable to tolerate oral medication. So kani siya mga indication sa intravenous. So kuan gid siya kanang pinaka kuan gid siya kanang common gid siya nga kanang ihatag ang medication sa usa ka patient pinagi sa IV or intravenous maski na sa mga dili makakuan og poor dili kaya makaabsorb og medication pinagi sa gastrointestinal tract through oral route. So and also intramuscular route can be utilized when oral drug absorption occurs in an erratic or incomplete patient. The drug has high first pass metabolism or when the patient is not compliant. So kani po siyang intramuscular no kung ang kuan daw ang oral daw drug absorption occurs in erratic or incomplete pattern kung dili pa siya kuan, pwede na daw ang iyang intramuscular, pwede na siya makakuan o metabolize to the patient medication. A subcutaneous route is used when the drug molecular size is too large to be effectively absorbed in the intestinal tract or when better bioavailability or a faster absorption rate is needed than the oral route. It is easy to administer and requires minimal skills to patient. So patient can often self-administer the medication themselves. Common medication administered subcutaneously include insulin, heparin, and monoclonal antibodies. So, kani siya, pwede siya kung sa oral dili makakuhan. So, pwede ang makakuha ng subcutaneous route maka-absorb sa medication. So, topical or other routes, topical application. Topical application produce local effect to skin, percutaneous either allergies, testing, topical local anesthesia, mucous membrane or respiratory tract or inhalation, either asthma, eye drops or conjunctivitis, ear drops, otitis externa, intranasal, nasal spray. So, kani siya mga topical application or other routes bitaw nga pwede na ihatag ang medication through other parts or routes of the body. So, na siya kung katong di iba katong sa parenteral kay sa skin, so pwede pa siya makakuha ng mga allergies, allergy testing, or anesthesia. And then, na pa siya other eye drops katong sa matay pagi, sa dunggan, o intranasal sa ilong. Inhalation advantages: mucous membrane of respiratory system, rapid absorption, large surface area, provide local action, minor systemic effect, low bioavailability, less side effects, no first pass effects. So, ang dosage form ni kay aerosol nebulizer. Kung na siya advantages, disadvantages, only few drugs can be used. So, kaning inhalation, kaning bitaw ang ikuan sa kanang inhale ba kanang like kanang nebulizer kanang ikuan bitaw sa kuan para makakuan sila o maka-feel og kanang kuan pag maglisod og ginhawa bitaw o sa inhalation. Kung kuan siya kanang mga few drugs can be used ni siya mga kanang few ra kay dili ra kayo kasagaran. Ay kanang panagsara siya bala kanang dili ra kay common. So, rapid absorption, yung advantages, and also less side effects. So, okay. Like mo rin siya ang mga kwan sa inhalation. Ako na mag-isulog ko na mga nebulizer, atomizer na ay siya murag gamay-gamay ra ang atomizer while aning nebulizer ginamit siya murag Inhalation route provides the rapid delivery of a drug across the large surface area of the mucous membrane of the respiratory tract and pulmonary epithelium, producing an effect almost as rapidly as with IV injection. So, good po ni siya, no? Inhalation route. Okay, more daw siya og IV injection nga almost rapidly like IV. This route of administration is used for drugs that are gases. Okay, gases na siya. Inhalation, inhale. Pag imong inhale, pagkuan sa oxygen. For example, some anesthetics or those that can be dispersed in an aerosol. This route is particularly effective and convenient for patients with respiratory complaints such as asthma or chronic obstructive pulmonary disease because the drug is delivered directly to the site of action and systemic side effects are minimized. So, kaning inhalation route, kaning kuan gini siya kanang mas kuan convenience siya sa mga patient nga na siya mga respiratory complaints like asthma or kanang magisud gid ginhawa kay direct to the respiratory or the kanang atong kuan gyud sa atong mucus atong kuan lagi respiratory sa atong lungs, I mean. Example of drugs administered via this route include albuterol and corticosteroids such as fluticasone, kasuni. And then intranasal route, kani siya, intranasal. This route involves administration of drugs directly into the nose. Agents include nasal decongestants such as the anti-inflammatory corticosteroid. Desmopressin is administered intranasally in the treatment of diabetes insipidus, salmon calcitonin, and peptide hormone used in the treatment of osteoporosis is also available as a nasal spray. The abused drug cocaine is general taken by intranasal sniffing. So, iba't din tong intranasal route. Kay, kani daw siya nga tambal, desmopressin is administered. Treatment ni siya para sa diabetes through nose, intranasal. So, tipo siya, no? Dili kita kabulo ni kay mahal tingali ni siya. So, grabe gid siya, no? Kanang through ilong siya route, through intranasal nga kuan. So, makaming skip siya. So, napod siya eye drops. Kani siya mga sa mata, no? Ay. So, ano siya mga tambala tingali kung pinagi sa, kung nasa ilong, kung napod sa mata, kanang like, kanang bujinggitong tingali ka, no? Ay, bujinggit, I mean, kanang biskaton ka. So, next is vaginal route. A vaginal route is an undexplored drug delivery route that is not commonly used but has the advantages of bypassing the first pass effect and can serve as an effective method for local and systemic therapy. The venous plexus from the vagina communicate with the vesical, uterine, and rectal venous plexuses and drain into the internal iliac veins. The veins from the middle and the upper vagina drain directly into the inferior vena cava and bypass the hepatoportal system. So kaning vaginal route dili daw ni siya kanang kuan kayo nga kuan siya nga pamagi sa route or dili siya ingon nga common siya sa ato sa kanang people human nga mag-medication ta or the patient pero mas kuan gid daw siya commonly used but dili siya commonly used but advantages siya through bypassing the first pass effect. So dili daw siya ingon nga commonly used, dili kay siya nga kanang permi gamiton or kuan nga route pero mas advantage daw siya through bypassing the first pass effect of the effective method for local and systemic therapy. Okay. So, dili man siya kaayo gamit, pero advantage gyapon siya sa vaginal route. Skin topical. dermal oil or ointment for local action, antiseptic cream and lotion, sunscreen lotion and powder. So kani siya murag kanang others na siya nga mga route bitong mga skin kanang murag specific na siya skin kanang mga allergies nimo, mga ointment pang kuan mo siya sa skin topical. So muna siya yung mga routes or other routes and antiseptic cream and lotion, sunscreen lotion and powders. Na pwede nimo siya i-medication sa imong throat skin. So, indication of other routes, medications. Sa intranasal route, medication can be utilized in administering nasal kung distance of for cold or allergy treatment. So, mo gini siya no intranasal ka ng cold ka kung tugnaon ba ka magbutang ba ka like ka tong mga rubbing or I mean kanang tawag gani kanang hatching bitaw ka allergy. So mga kuan na siya sa intranasal route allergy treatment. Other uses include desmopressin for the treatment of diabetes. So mo na siya kung kuan ganiha. Then an inhaled medication route can be utilized to administer albuterol or corticosteroids such as fluticasone and deliver inhaled anesthetics to patient. A vaginal route is not commonly used but not deliver low continuous dosing of medication which can help achieve stable drug levels. So, mo gid siya no giingon ganihan no nga dili man siya gamit kayo pero advantage gyapon siya through medication to help achieve stable drug levels. A variety of formulation can be given vaginally, including tablets, creams, gels, ointments, and PCRS. Common medication given via vaginal route include vaginal estrogen therapy for urogenital atrophy, contraceptive rings, antibiotics, or antifungal. So, kani siyang vaginal route, pwede din siya ang mga medication ani like tablets. Pero katong mura nagihay siya kung ay specific kung sa yun siya nga mga tablets. Creams, gels, or katong pagtaod sa contraceptive bitaw nga sa sulod ipag-ibutang or sa bai sa vagina ikuan contraceptive ring and also anti-fungal. So in all routes there are contraindication nga kung na siya indication nga palatanda na po siya kontra. Each medication administration route has unique contraindications, and the healthcare team members need to recognize them. An oral medication route is contraindicated for patients who cannot tolerate oral drugs, such as those who have altered mental status or have nausea or vomiting that hinder them from safely ingesting the drug orally. A rectal route is contraindicated in patients with active rectal bleeding or diarrhea or after a recent rectal or bowel surgery. An intramuscular route is contraindicated in an active infection or inflammation. At the site of the drug administration, myopathies, muscular atrophy, thrombocytopenia, or coagulopathy. So, ano siya mga indication sa sugod sa oral route, parenteral route, subcutaneous route, IV routes. So, subcutaneous route medication and contraindicated in an actively infectious or inflamed site. Doses that require to be injected more than 1.5 ml at once should be avoided. Subcutaneous injection volumes larger than 2 ml are associated with adverse effects including pain and leakage of the injection site. An intranasal medication is contraindicated in patients with nasal trauma, anatomic obstruction, presence of a foreign body, or obvious mucus or bleeding. Similarly, inhaled medication is contraindicated in patients with airflow obstruction. So, atong ganiya sa mga sa indication mo to siyang kuan nga kani nga route is pwede kuan siya nga ihatag nga medication. Ang kaning contraindication murag iyang effects kung ihatag nato ang medication this route, kung unsay mga probably nga kuan niya effects or kanang contraindication. So ato may ano gikan sa orally katong bawal ni siya oral ihatag ang medication through orally kung ang patient na siya vomiting or nasaya or unconscious siya nga patient, so dili siya contraindicated na siya. And also sa rectal route contraindicated po sa patient katong dili na siya sa rectal surgery or bowel surgery, so bawal po dito ni siya ikuan ang medication. Sa subcutaneous, so dili po dapat ang kung sa subcutaneous route, dili po dapat manglapas ang inject to 1.5 ml. So, and also sa intranasal, dili po contraindicated po niya ang katong na siya nasal trauma or anatomic obstruction also or presence of foreign body. So, bawal gid siya ihatag ang medication through intranasal kung na siya mga indication sa route. So, ano siya ang atong dumduman sa atong mga contraindications in different routes. So, that's all no. So, for me, so sa tanan, dapat gyud sa paghatag sa atong drug administered, dapat makabalot ta kung unsay mga rights as a patient, rights sa kung pagpabalo sa patient. And also, check and verify all the doctor's order kung sige kuan. And dapat klaro gid nato kung unsay ihatag or doctor ang orders, kung unsay medication, kung asa ihatag ang medication, unsa nga mga tambal. Kay para gid ang mga errors dili gid makuan kuan. So that's all. Thank you for listening, and that's all. Bye.